Dr. Kevin Cavanaugh has been a regular on this program. He is part of our stable of stars for some time, and he brings some of the greatest guests involving health and health care that I've ever seen. He may have outdone himself this morning, though. Good morning to you, Dr. Kevin Cavanaugh.
Oh, good morning, Jack.
And Kevin is not only a retired physician, but also the founder of an organization called Health Watch USA. Can you tell us what that's about?
Yes, Health Watch USA is a 501c3 nonprofit organization, and we're dedicated to performing research on healthcare policy and also advocating for healthcare policy for the improvement of quality and lowering of costs. We're right now a national organization. We have a national board of directors and have served on last year sources for major news outlets, along with trying to increase consumer awareness through op-eds and a show such as this, which is our main outlet. So we appreciate being on the show very much, Jack.
Please introduce us to your guest this morning.
Yes, well, as Jack was saying, we are extremely privileged to have as our guest Steve Burrows, who's the award-winning producer of the HBO documentary, Bleed Out. The film describes the devastating encounter that his mother, himself, and his family had with the healthcare system that resulted in a decade-long cascading of errors and cover-ups. And for me, the title of Bleed Out was very appropriate. It literally applies to what happened to his mother during surgery, but metaphorically, what happened to the emotions and finances of both Mr. Burrows and his family. So at this time, let me turn the program over to Mr. Burrows. I'm sure he's got an abundant amount of interesting information and will tell us some really horror stories about what's happened with him with the healthcare industry.
Steve, good morning, and thank you for being with us.
Great to be here. I really appreciate it.
Oh, we appreciate it. I know you're on the West Coast, too, so it's the middle of the night, and we especially appreciate you getting up so early to be with us. Steve, your documentary, Bleed Out, was the winner of the Best Feature Documentary and Best Medical Reporting. Los Angeles Press Club said Bleed Out is absolutely mind-blowing and great storytelling, but you didn't start as shooting a documentary. Can you kind of start at the beginning and tell us your story?
Yeah. Again, thank you for having me. I've been out. I originally from Wisconsin and came out to California a couple decades ago as a comedy writer, director, performer type. I was, full time on TV, movies, TV shows, and like I was on Seinfeld, a lot of Super Bowl, did tons of commercials as an actor, and then as a writer and a director. I was all about comedy, 100% comedy, 100% of the time. And then 10 years ago, my mom, back in Milwaukee, Wisconsin, she's a retired school teacher, went in for a routine partial hip replacement in Milwaukee and came out in a coma with permanent brain damage. Mm. And I was there when it happened, and my uncle is a doctor, my aunt's a nurse, and they told me right away that they felt that this was not something that would happen naturally. This was not, brain damage is not a known risk factor for hip surgery. My aunt and uncle told me to get the medical records right away. They told me to become my mom's power of attorney, which I did, and then once they saw the medical records and they saw that these records, especially the surgical records in the surgery, my mom, it was supposed to be a 2-hour surgery for this routine hip, and it ended up going 6 hours, and she ended up losing over half the blood in her body.
Oh,
and
mercy.
Yeah, that was the original telltale sign that we had something that was not right. She was on a blood thinner called Plavix, which a lot of people are on, and it's a very safe drug. But when you go into elective surgery like that, even Plavix says that you want to be off this drug anywhere from 5 to 7 days prior to any elective surgery. Otherwise, you might bleed out. And her surgeon and her anesthesiologist felt that there was not an issue here. I remember talking to them about this beforehand, and they had never had a problem with the Plavix. And then all of a sudden, Mom gets in there, and she loses literally over half the blood volume in her body. And then she was taken up to this, after the surgery, she was taken up to an ICU in this hospital intensive care unit where there was no doctor in the ICU. It was just a young nurse who was a very green nurse. And my mom's blood pressures continued to drop to below 50 over multiple times over several hours. And no doctor was called in. They had something called the EICU. Jack, have you ever heard of this, what this EICU is, this electronic ICU?
Nope, don't have any clue.
Yeah, you and almost everybody out there, including so many people in the medical industry as well. I didn't know anything about it. We didn't find out about it until several days after my mom was in a coma.
Can I guess? What that is? Because I absolutely have no idea. But my guess would be they're hooked up electronically, and somebody in China is looking after them. Or am I close?
Well, yeah, you are close.
Okay.
Basically, in a hospital, there's an intensive care unit with critical care patients like my mom or like anyone who's gone through a surgery or whatever they're doing after they're taken up there. And in the ICU room, there's a camera that is theoretically monitored off-site remotely by a doctor. Now, it could be in another building, it could be in another city, it could be in another state, it could be in another country. In my mom's case that night, the ICU doctor had been replaced by this camera doctor out by the Milwaukee airport. And when we started asking questions about how that all works, we were told that camera was actually never on. And we're like, what are you talking about? So the doctor, the bedside ICU doctor was not there, replaced by the camera doctor out by the airport, but the camera's not on. And we asked why, and they told us, I swear this is true. This is all in depth. We went through a 7-year litigation on this case. They told us the camera wasn't on due to patient privacy issues.
What?
Welcome to my world, Jack.
That is so absurd. I can't even imagine.
Yeah. So once we started to see what we were up against here, mom's going in for this surgery. She comes out in this coma. And the other thing I would tell you is that in this ICU, they did not notice my mom was in a coma for 2 days. And I was there. The first day after the surgery, I was there all day, and they just kept telling me she was foggy and groggy. She lost some blood, and, she had a long surgery, but she's okay. And then the second day I came in, and she was, she looked like she was dead. And this was my moment of, this was my personal moment of truth, as a son, because I never want to offend doctors, and I never want to, I'm not a confrontational person, but I could just tell that my mom was in trouble. My internal red flag went off. So I caused a commotion in that ICU. I wanted to know why my mom was not awake after 2 days. She's supposed to be up and walking the next morning. And after a whole bunch of activity where I literally had to raise my voice, and this is so not me, but I just felt my mother was dying. And they call in a neurologist due to my hissy fit, and the neurologist looks in my mom's eyes and says, you know what, she's in a vegetative state. We hope she wakes up, but she might not. And that's how this whole thing began.
Oh, my goodness. Oh, Steve, I can't tell you how badly I feel for you. I can't even imagine. And this was 10 years ago.
Yes, this was November 2009. Yeah.
Now,
So,
let me ask you this: how did the literature that I read said that you were, obviously you weren't shooting a documentary when you started. You were shooting what they called, I think, a video.
Maybe a diary.
I was just shooting. When this all happened, and we started to see that the records were not. My uncle, the doctor, said immediately when he saw the surgical records, he said they were falsified. And he told me that I needed to contact a malpractice attorney immediately, which I did. And that attorney, these guys are hard to find because it's so difficult to prosecute these types of cases. Mm-hmm. Because juries do not like to convict doctors, even if there's wrongdoing. They just don't like to do it. Mm. These cases lose 90% of the time.
Wow.
No matter what.
90% of the time.
90% of the time that was in Wisconsin and across America, 90% of the time, and these attorneys who work for patients, injured patients like us, they're all on contingency fee. They don't get paid by the hour. They work contingency. So in our case, our attorney worked for 7 years for free, And he knew going in that he had a 90% chance of losing this case, regardless of, all the evidence that we acquired. And one of the pieces of evidence that I was told to do was to start filming my mom's pain and suffering.
So
right
that's
out
when you.
of,
I see. So you
Yeah.
started at that point.
Yeah, I had no idea I was making a film. I was basically just I was doing exactly what our attorneys told me to do, which was document my mom's pain and suffering, which was incredibly difficult, as you can imagine, to film my mother in a coma, and then when she started to come out of the coma, and this is all highlighted in the film, and her whole, she ended up being, devastatingly cognitively and physically disabled, and I was dutiful. I was doing what was in her best interest, certainly for her case to get her justice, was to film all this stuff.
Sure.
And about 4 or 5 years into the process of waiting for our trial, a friend of mine out here, who's a documentary filmmaker, said, he goes, I think you might have a movie here. And I said, I don't think so. I mean, who wants to see a movie about my mom, like in a coma? And then we found out that medical error is the third leading cause of death in America.
Say that again.
Medical error is the third leading cause of death in America. There's an iconic study done by the British Medical Journal, and a doctor who's actually in our film from Johns Hopkins. His name is Dr. Marty McCary, and medical error is the third leading cause of death after heart disease and cancer.
This is an amazing story that, some of these things we talk about on the air are interesting, and some of them are, controversial or whatever. But this is an important show, Holly, and you've been sitting there, our producer, Holly Brady, for your information, Steve, has been sitting here this whole time listening to you with just about the whole time with your mouth open. It's like you're not believing what you're hearing.
Yeah, it's unbelievable. And I was saying, Mr. Burrows, to Jack off the air, that I used to work at UK, the University of Kentucky here, with their standardized patient program, which is part of the medical training that a lot of the students there get. And the focus of the training is not about the doctors diagnosing necessarily what's going on with the patient, but it's more about the listening to the patient and trying to teach these doctors that it's okay for patients to question their judgment or to ask them questions that they may not immediately know the answer to, because we're trying to break that barrier. And the part of the story that you were telling that really caught my attention was the moment where you said, I sort of had to throw a hissy fit, I think you called it. And you said, that's not like me, but you had to really call these people down. And then you went on to tell us that, a lot of times, I think you said 90% of the cases that juries won't even, make a judgment against doctors. And I'm not suggesting that in every case that they should. I'm only saying that I think all of us, as a society, we're very scared to cross doctors. We're scared to ask questions, or we're scared to suggest that they might not know what they're talking about, because we've been taught that they're an authority figure and that we're supposed to do what they tell us. And I just thought a really remarkable part of this story, and obviously the catalyst to make something happen, was you finally saying, I'm not just going to take this information. I'm going to ask my questions, and I'm going to say, I don't think this is right. And that's what we all need to be doing, even in things that aren't life or death. We need to always say, wait a minute.
You're absolutely right. I mean, I learned a couple of really hard lessons pretty quick, and one is just questioning everything and not being rude about it, not being professional, being polite. But I've learned through this experience, and certainly since the film has come out. The film has been out for 1 year now on HBO, and the last year that it's been out, we've been very fortunate enough to. The press has been just great. The critics, and then the public got a hold of it. And HBO told us over 10 million people have seen this thing. And my wife and I, we personally heard from over 6,000 people out there across the country who we don't know, who saw it, and they said, "Well, this happened to us." So it's been an incredibly encouraging and promising response to this film. But the best thing about it has been recently. The universities and the medical schools and the hospitals and the nursing schools have caught the film. They've now looked at it, and I really, to be honest, I thought that there would be a lot of blowback, a backlash from the medical community, and I could not have been more wrong. And in fact, that's where I met Dr. Kavanaugh. Was at we were just recently at this Leapfrog group in Washington D.C. where we screened the film for a bunch of hospital administrators and doctors and hospital CEOs, and I told the event person, are these people going to get up and walk out of here? I don't know. And it was just the opposite. I've learned that great doctors and great hospitals. First off, we're all human, right? We all make mistakes.
Mm-hmm.
So, the question is, what do we do when we make those mistakes? And the great doctors and nurses and hospital systems, they embrace those mistakes. They share those mistakes. They don't cover them up. They want, like we interviewed the Mayo Clinic in the film, and I learned that when something goes wrong at the Mayo Clinic, they not only do a root cause analysis of what the heck just happened. Let's just say somebody cuts off the wrong leg, which, by the way, happens 40 times a week in America. They cut off the wrong limb. Wow. So what a hospital system like the Mayo Clinic does, or the MedStar Health Institute out in Maryland, these hospitals that have embraced accountability and transparency and apology, they will share the information not only with all of their other medical practitioners on why this happened, very much like in aviation. When something goes wrong in aviation, when they find out what happened, they share it with everybody so that it doesn't happen again. And that's not happening universally in medicine, and it really needs to. But some hospitals and some hospital cultures do embrace it. And in the cases of like the Mayo Clinic, when something goes wrong and they share whatever happened, the idea is that when the mistakes are made, instead of being punitive, instead of being all litigious, let's figure out what happened. Let's figure out why it happened. Let's make sure it doesn't happen again, and let's go over to the family and tell them the truth.
The title of the documentary film is Bleed Out by Steve Burrows. True story about his mom. Went into the hospital for routine hip replacement surgery, lost half the blood in her body. A 2-hour surgery ended up being 6 hours. Ended up in a coma, extremely debilitated after she came out of the coma, and still more of the story to tell. But I want to give Dr. Kevin Kavanaugh an opportunity to jump in here too. Kevin?
Yeah, well, thank you, Jack. To me, the biggest issue, and believe me, this film covers about everything what's wrong in medicine, but the biggest issue is the lack of transparency and not telling patients a medical error has occurred, and then sincere apology and rapid compensation. This is not ethical, what was done. It's not ethical according to the AMA. It's not ethical according to the American College of Physicians. And it's not ethical according to the Leapfrog group. And it's a mindset which is all too common in medicine of defend and deny instead of full disclosure. And unfortunately, if you get into this mode of defending and denying, what happens is it's harder for you to address the problems because everybody's involved in the cover-up. If you look at the film, you could think, my goodness, how big did that cover-up have to grow in order for it to become effective? And when you do that, you find your quality ratings drop. And this is, I think, indicative of the Leapfrog group and the Leapfrog hospital quality ratings at Mr. Burrows' hospital, his mother's hospital. I believe they had a Leapfrog rating of a C. And we have hospitals in Kentucky that have Ds. And this is something that really needs to get addressed. The hallmark of correcting an error is first admitting that you have one. And I think that is extremely important. So this film, I think, is literally groundbreaking. And then one of the other cornerstones of medical errors and of the Leapfrog standards is to not charge the patient for care related to the error. So what Mr. Burrows went through is kind of like putting salt on the wound. Not only did a drastic error occurred, but then they had to cope with all these bills that were coming down the line, some of which could be just astronomical. And you also get into issues of surprise billing and all sorts of problems that families are having just paying for basic health care. So I'd like to ask Mr. Burrows what he thinks about the system of having to pay for the error that occurred.
Well, I can only tell you that I think it stinks. My mom, as I said, was a retired school teacher, special ed school teacher. She had managed to save. She was a single mother, and she managed to save over a 50-year period $200,000. That's what she had when she went in for this surgery. And after she came out in a coma, and she was on her insurance company and Medicare were covering her, but her insurance crapped out on this after 100 days. So 100 days, she was still, she was just barely coming out of this coma situation.
Did they stop paying after 100 days?
That is correct.
Why?
That is correct.
Why?
The insurance because the insurance company. See, at this point, we thought that the hospital system should take financial responsibility for my mother, because it happened under her roof, and this is not something that was clearly a natural event. Mm-hmm. But the hospital disagreed. We were actually kicked out of the hospital after that was after 2 months. We were kicked out of the hospital. I can't say it was just the hospital. It was the hospital and the insurance company said we had to leave, and we went to a rehab facility where we had 100 days on. We knew exactly to the day. We knew exactly how long my mom had until she started actually paying out of pocket for her care. And 100 days later, my mom was 100% responsible for the injuries inflicted upon her financially. And her costs were anywhere from, at that point, $6,000 to $7,000 a month cash. We went to an assisted living facility, and there's no insurance at these assisted living facilities. They take cash. That's it. And we knew at that point, you just do the math. She had $200,000. She had a full pension and Social Security. She had everything. She had her house paid for. Everything was, she did everything right, and she ended up losing every single penny she saved her entire lifetime to pay for her.
That's just criminal. So what are your attorneys saying through all this?
Well, our attorney said that, we got to stay the course. And it's going to be tough because they're going to drag this out. As Dr. Kavanaugh just said, there's the tactic is to delay, defend, and delay the proceedings for as long as possible. And in fact, in the state of Wisconsin, I know this is going to sound crazy, but it's all true. It's in the movie, and I went through a full year of legal vetting with the HBO lawyers, because even the HBO lawyers, as I'm telling you this, they're saying the same thing to me. They're going, "What? We can't believe this. This can't be happening." But in the state of Wisconsin, there's several laws in the state of Wisconsin that, and some of them are actually national laws as well, that are against patients. For instance, if you're a single person in the state of Wisconsin, meaning like my mother, who does not have any minor children or does not have a spouse, if she dies due to medical error, there's no case. So our lawyer just said, keep your mom alive, because if she dies, there's no case.
How can that be?
Yeah, how can that be?
It's on the books. It's called the single person law. There's another law in Wisconsin, I'll just tell you real quick. It's called the I'm sorry law. And this law says that if a doctor or a hospital apologizes to you and admits their guilt, let's say, like in the case of our doctor, if our doctor just said, hey, you know what, we blew it. We blew the Plavix thing. Sorry, we blew that. We didn't notice your mom was in a coma for 2 days in the ICU. If they would have said that I'm sorry admission is not it's not admitted into the court of law. It's not allowable. I'm not using the right word. It's not admissible in the court of law.
So it's like somebody coming in and admitting that they killed somebody, but they can still plead not guilty, and you have to prove it.
That's right, and then you can't use their admission against them.
Yeah.
Wow.
We were up against that, so we kind of knew we were up against, certainly in the state of Wisconsin, but also this is a national epidemic as well, and we just generally these cases go 2 to 3 years. Ours went 7 years.
What was the outcome?
Well, spoiler alert. We had such overwhelming evidence in our case We had falsification of records. We had doctors and nurses lying under oath, committing multiple acts of perjury. I actually went undercover at one point with a spy pen, and I did that very reluctantly, but I noticed that a lot of the doctors and nurses in our case were not telling me the same thing they were saying under oath, and no one would believe me, so I actually filmed them saying things that did not match with their under oath testimony, and that's all presented in the film. We had medical records in the case that were medically impossible in the history of medical science, and we lost our case.
You
we
lost.
got slaughtered.
Oh,
we
my
lost.
gosh.
Yeah.
You lost.
Yeah, we had a grand slam case, and it's, as Dr. Kavanaugh has seen in the movie, we present all the evidence. We show all the undercover footage. We show all the medical evidence that we got in discovery. We show all the, I videotaped all of the depositions of all of the doctors openly, in a court of law. We show the depositions in the court, and you can decide as an audience whether what's true or what's not true. But the evidence is absolutely overwhelming.
And I think one of the problems that I saw in the whole system, which is one of the reasons we lost the case, is that they couldn't identify who was responsible and who was in charge. It was pointing fingers to everybody. And if you can't identify who's responsible, who's in charge of the care, it's hard to hold anybody responsible to a bad outcome.
So it came down to just not having one final person where the buck stopped.
That's right. Basically, we had a surgeon, we had an anesthesiologist, a primary care. There was an ICU doctor. There was the camera doctor out by the airport. There was the young nurse who was thrown into this horrible ICU system that she didn't understand how it even worked. Nobody through this entire 7-year litigation, no one, not one attorney, not one defendant, no one ever disagreed that this didn't happen to my mother. What the disagreement was who was responsible for it. Dr. Kavanaugh's correct. I spent 7 years trying to get to the bottom of who was in charge of my mom's care, and there's a sequence in the movie where they're all asked, under oath, on camera, were you in charge of mom's care? Wasn't me. Wasn't me. Wasn't me. Surgeon says it was the anesthesiologist. Anesthesiologist says it was the surgeon. Surgeon says it was the primary care, et cetera, et cetera. They blamed each other. They passed the buck, so the jury got very confused. And, in the end, the jury had to actually decide who was negligent, who was the cause of my mom's brain damage. And they were completely befuddled. They were, was the surgeon 25% responsible? Was the anesthesiologist 10%? And the ICU doctor, who wasn't even there, was she 35%? This is how they have to figure it out. And in the end, everyone, in the end of trial, everyone kind of in the end started blaming the nurse who was by herself in this EICU thing, and which is an old tactic. I mean, maybe Dr. Kavanaugh can speak to that, but there's an old tactic that once they start blaming the nurses, the jury's never going to pull the trigger on the nurse. Never going to do it.
What do you say, Kevin?
Yeah, and this is one of the problems of malpractice and why most cases don't go to trial. Because it's almost like the wearing you down or wearing down the plaintiff. And it's stressful on the patient. If you have the doctors on the phone, they would be just as stressed by the whole process, which is why when you hear all this, how can you have a quality institution? And why defend and deny is so bad. And this whole idea of a tele-ICU, for me, I wouldn't be in there. Because with telemedicine, physical exams are very hard to do. When you're in the ICU, there's not much history, so there's really not a whole lot you can do by a camera if you can't examine the patient. And I'm very hesitant even on the big drive for telemedicine. I think it has a place, especially in areas where there's not doctors, but some of the research looks like the quality is not as good. There's a recent National Institute of Health project that looked at antibiotic prescriptions, and unnecessary antibiotics were sky high in telemedicine, much more than in a primary care doctor's face-to-face visit. So when you put it in the EICU setting, it's going to be even worse.
All right, we're going to jump in here and take our final break, and when we come back, we'll wrap this up. Unbelievable story. And in case you just joined us, we're talking about a documentary film. The title of the film is Bleed Out. Man, I'm just blown away by this show today, I'll just tell you. Just can't believe it. Steve Burrows' documentary film Bleed Out is our subject this morning, and the story behind that. Steve is with us. Dr. Kevin Cavanaugh is on the phone also, and Holly Brady with me in the studio this morning. Steve, tell me there's some good news. There's something positive that came from this horror.
Well, you know what? A year ago, I couldn't tell you anything, but just in the last 6 months, you know, we've been invited to these to show the film at the medical schools and the nursing schools. And I was, as I said before, I was really not reluctant, but I thought these screenings aren't going to go well. I mean, this is not an anti-medicine, anti-doctor movie at all. In fact, it's a love letter, in my estimation, to all the great facilities and doctors and all the healthcare providers out there that really are doing the right thing. But we went out to several of these medical schools and screened it, and these young residents, these medical students, these young doctors, and their faculty members are 100% behind this movie, which was such a pleasant surprise for me, because, as Dr. Cavanaugh said, for whatever reason, because of this 10-year journey that I was filming on my iPhone all these years, at one point or another, not really intentionally even doing so, we stumbled into like the medical industrial complex, the financial aspects, the legal aspects, the patient aspects, the doctor's points of view, and it just I actually have a lot of hope. You know, I don't blindly trust doctors anymore. I trust them certainly, but I ask a lot of questions. You know, you got to have an advocate. You know, when you're sick, you know, you're in no condition really to be asking questions and advocating for yourself. You need someone to help you advocate. Second opinions are just incredible. Great doctors and hospitals love second opinions because it helps give them another shot at taking another look at what's going on. Because we are all human, and you know, these doctors and nurses, and they're incredible people. They're incredibly talented and they're incredibly educated, but they are human. And you know, questioning everything is really it's counterintuitive, certainly in the medical field. But in my experience, it's really the only way to go. And great doctors and hospitals and nurses, they don't mind it. They encourage it.
Yeah, no, you're exactly right. That was my experience at UK. And in fact, when we were on a break here, I texted the man that's in charge of the program there for the standardized patients, and I said, you need to see this movie, and you need to send it to the people at the College of Medicine, if they haven't already seen it, to share it with their students, because what you've done here is really important. What you've brought to light is really important, and you're right. People want to do the right thing. They just need to see that it's important, why it's important, and what the repercussions are if they don't.
Right. You know, the one last thing I would tell you that I learned really is that you need to really shop for your doctors and hospitals and healthcare providers. I didn't know this. This is also counterintuitive. We shop for everything else: houses, phones, big screen TVs. But tell me if I'm wrong, Dr. Cavanaugh, but except in healthcare, in no other situation do we buy stuff without asking the price. Right?
Oh yes, and if you ask the price, a lot of times they say, I don't know, I can't give it to you. And then if you get a doctor that's out of network, its cost can be out the roof. Very frustrating. There's no good answer.
No. I've learned, the big thing I've learned in trying to figure out who was in charge of my mom's care all those years ago, and after all these years, I still don't know, but I've been asking in some ways the wrong question. You know, the question is, who's in charge of health care in America? Who is it? And I ask this question at every time I screen this film, and I just screen it for all, you know, hundreds of doctors in the Leapfrog group, and there was a screening the month before for 400 brain surgeons, and I asked a simple question. Okay, I've got a room full of Mensa smart people here. Who's in charge of health care? And the answer is, you know?
Let me ask you this, Steve. Did the hospital providers of the insurance ever offer a settlement?
No. No.
Really?
No.
Wow.
No. Delay, defend, deny, and they'll fight to the death because they know the numbers are if they continue to fight it. In my case, either my mom dies and the case goes away, or they just want to wear you down, and it's incredibly expensive. It costs us over $250,000 cash to prosecute my mom's case. Now, who has that kind of money? Nobody, right? So if you don't have that kind of money, then you don't. You need expert witness doctors to back up your claim, which we did, and they're $20,000 to $30,000 a pop. Just to even look at the records, and then to go on, and testify, and then they know the numbers. They're going to win 90% of the time, so they figure, well, let's just see what happens.
Go ahead.
It's kind of the opposite of a slap suit, instead of on the plaintiff side, it's on the defense side. The defend and deny is very, it's very commonly used, although there's been recent studies that show that rapid disclosure, compensation, and apology actually can result in lower overall malpractice costs, let alone improve quality and a lot less stressful on both the patients and the healthcare system. And to put an injured family through the added agony that Mr. Burrows and his family have went through is just plain cruel, and we need to have something better from our healthcare system than that.
Dr. David B. Mayer of the MedStar Institute for Quality and Safety recently stated, bleed out is literally saving lives. Now, how many films can you say that about? Steve, I can't tell you how much we appreciate you being with us this morning, and we appreciate very much, Kevin, you bringing him to us. Thank you.
Thank you, sir.
Thank you. It was a privilege. Thank you very much. 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 Privilege. Thank